I'm Jesse Topper, State Representative in the 78th Legislative District, and I'm pleased to be at the American Association of Nurse Practitioners breakfast this morning at the Hilton here in Harrisburg, and also pleased to be joined by Dave Hebert, the CEO, and we just found out a lot of great information from Dave in at this breakfast, and perhaps you could give us a little idea of why nurse practitioners are so essential to affordable and accessible health care here in Pennsylvania.
Well, thank you, Representative Topper, and thank you for all you do. It is critically important to make sure that we are taking the appropriate steps to right-size scope of practice laws and licensure laws. Nurse practitioners are key in the primary care equation. We've got a problem in a lot of states where essentially there's difficulty in allowing patients to access nurse practitioners. And this is a problem on a couple of levels. Number one, there are not enough primary care physicians to provide primary care in Pennsylvania, so we have a lot of underserved areas. Secondly, the extent to which we can right-size the scope of practice laws, which is pending in the legislature, the representative can talk about, is the fact that there is an impediment with a collaboration requirement that needs to be addressed because otherwise Pennsylvanians in many areas, particularly in rural areas, may not have access to nurse practitioners. And it's particularly important at this point in time, not only with the number of retiring baby boomers, but also just generally speaking for Pennsylvanians across the state to have more access.
And one of those bills is House Bill 100, which I'm the prime sponsor of, which allows nurse practitioners to practice without that collaborative agreement. While I don't have a healthcare background, one thing that I've found in the legislature is that more paperwork is always an impediment to better health care, and that's really what we're looking to eliminate. We're looking to allow these trained professionals to do the job that they were trained and educated to do without the extra burdensome red tape that has to be cut through for them to be able to serve our constituents, and I'm looking forward to continue that process. So I'd like to thank Dave and all those who have helped to advocate for nurse practitioners throughout the state and throughout the country. Thank you very much.